Well, and talk to us a little bit today. What's the sort of announcement that's come from the government, and what does that mean for the childhood cancer research space?
An exciting announcement today from the federal government and the Minister of Health around an investment into childhood, adolescents and young adults. It's been a bit of a journey over the last 12 months since we asked for a mission and funding from the federal government through the Medical Research Future Fund. The great thing about it is we've got sector support for this sort of funding, oncologists, researchers, charities, non-government organisations, individuals throughout the sector, people who advocate for better services, families, people that have gone through a childhood cancer or a AYA diagnosis and then treatment. And everyone's come together to understand what the unmet need is, worked hard over a 6-month period putting a roadmap together, and to finally have an announcement of some investment into changing some of those unmet needs and an investment into research, clinical trials, supportive care, innovative therapies for paediatric and AYA cancers is a real win.
What do you mean that you talked about the mission and the roadmap? What do you mean when you talk about those things?
Yeah, so the roadmap has been put together and led by Cancer Australia and the whole sector. It's a high-level policy document that will hopefully lead into some policy changes, but also into further investment. It's about engaging the wider sector about what's required, in understanding unmet need, knowing what priorities should be as far as investment, where there are holes in the current health system, and over the next 10 years how can we invest and fix those as a wider group, collaborating in that funding, making our dollars go further, so both the government's taxpayers' money but also our donors being able to invest, and then every other charity. So to have 30 plus charities, research institutes, hospitals from across Australia, all engaged and all discussing what should be in a roadmap and what we should be striving to do, and then have an announcement of a mission then, which is the government's first commitment into it. So it's a great initial announcement. It'll allow us to leverage more funding. It'll allow the charity sector to come together. There'll be a more dedicated sort of focus on where our investment can go and how our money and across Australia, our donor money can be united for a greater impact on paediatric and AYA cancer.
Obviously, it's been a bit of a journey. Talk to us a little bit about that and what the Kids Cancer Project's role has been in that.
Yeah, it has been a journey. Pre-election in 2025, the Kids Cancer Project was driving for a mission. We weren't successful at that stage in getting an investment, but there was real sector appetite for coming together and having a real impact on childhood and AYA cancer. So to be able to work with Cancer Australia, work across the sector on coming together, building a roadmap that sort of, will hopefully future-proof the space. It's around supportive care, so it's got charities and organisations that are service providers. It's got not-for-profits that are funding into science and innovative treatment and supportive care. So it's a whole sector. It's everything that's involved in childhood cancer. It's about building, and future-proofing, an experience for people and families and young Australians that are diagnosed and their families that have to go through this, that hopefully in a decade's time it'll be a much better experience. They'll have better support through hospitals, better programs, better treatments, better access to care, better quality of life, survivorship programs. So it's looking at the whole, I suppose, life cycle of someone who gets diagnosed, and then how do we have more innovative, bold treatments that have less side effects, that improve their quality of life, and it'll be a bit of a game changer. And I think the most exciting thing, as I said, is that everyone's aligned in what we need to do. So our investment should be aligned, and there'll be less duplication and a much better outcomes for every child, adolescent and young adult that's diagnosed with cancer.
Obviously, there's been an investment by the government. Why then is continued investment still so important in this space?
The announcement today of the government support in this space, so there's a focus around brain cancer through the Australian Brain Cancer Mission. That was a mission that was started 8 years ago, and a $50 million commitment from the government led to over $126 million being invested. So it's an anchor commitment. They're committing into low survival cancers. We're also supporting childhood and AYA cancers. So it's about now, what seems like a large sum of money, $50 million, over 10 years, being leveraged, having like-minded organisations coming together, and the power of a collaborative group making real changes for people that are diagnosed with cancer here in Australia. So there's a large amount of people that have this sort of experience changes their life. So whether it's a young child or a parent or a adolescent or a sibling, grandparents, their wider community, everyone's affected by this. So this sort of investment, will be focused. That wider sector have agreed through the roadmap where we should be investing, and now we get an opportunity to really collaborate and work together on solving a few of the issues in the systems and the unmet need, and where we need to spend our money to get a real bang for our dollar, bang for our investment. So that's from the Kids Cancer Project and other charities' perspective, it's about using our donors' money to the best ability. So this government investment will anchor our investment, and we'll be able to invest more wisely and be able to have a greater impact on childhood, adolescents and young adult cancers.
To that point, the investment from donors, partners, community fundraisers is still so important for the Kids Cancer Project.
Yeah, it is. I mean, this announcement's just one component of what we're doing. So if I look over the last decade, the Kids Cancer Project has been able to commit close to $50 million to childhood, adolescent and young adult cancer research and supportive care and survivorship, and projects that build capacity and capability. So it's an ongoing challenge. This is just going to be one component. So we will be able to fund through the mission in collaboration with the government, but there are also things for us to be able to achieve our research strategy, and our research investment is to also fund outside, and the ability to do that collaboratively with multiple groups will really enhance what we're doing. So, the great thing about this is, yes, it is a large investment. Yes, we do need more to fast track and improve. Like, our vision is about, changing the statistics, so 100% survival. So yes, we are, it used to be at 50%. It's now at 87%, but, in a decade, would it be great if we could celebrate, getting closer to 100%, that every child survives, and then not only survives but thrives through better kind of treatments, and they have a better quality of life, and the experience for these children, and an ongoing experience. We talk about survival rates, but they're at 5-year survival rates. When you're 5 years old doesn't sound like 10's a long time. So we need to have better quality treatments, and to be able to invest into research that'll, discovery research that'll give us a pipeline to be able to translate that research into from the bench to the bedside, and where these kids are getting actual treatments in a clinic, and then they're less harmful and less side effects, is really important. And that's why we will continue to encourage donors to support us, so we can make a real difference in that space.
So obviously, announcement today, what's sort of the next steps from here? What does it look like over the next 6-12 months, and then beyond over that 5-year period as you spoke about?
Yeah, I think the exciting thing about today's announcement is it's a roadmap and an investment into some missions that will support, but more importantly than that, it's the whole sector are engaged in coming together and putting that roadmap together, understanding what's required, and being able to invest more wisely to make a real difference, to multiply our impact by a anchor commitment from the government allows the Kids Cancer Project to support, but it also lets 30 other charities that have been part of this process to either support through advocacy or through their life experiences or through their donors' funding, and we'll be able to partner more and more to have a real impact on childhood cancer, AYA, and a real impact on hopefully survival rates and the quality of life moving forward.
Obviously, the mission is for quite a substantial period of time as well. Are there any sort of projects or things in that next little window of things that people will start to see get rolled out because of the mission?
Yeah, part of the roadmap was sort of, coming together and looking at potential priorities, understanding, what is in the pipeline already. So I think, even in the meantime, there's an opportunity to invest in some, innovative therapies, in some research projects. The Kids Cancer Project in the next month look forward to committing over $1.85 million to 5 new projects. But there's a real opportunity, for us to collaborate and co-fund and look at new projects, look at, innovative pathways that will encourage more research to move to the clinic and how that's supported. So I think, in the supportive care space, there's lots to be covered off, looking at what that looks like for a patient and what the optimal care pathways for those patients look like and how they have, a great experience. And I think, from the Kids Cancer Project's perspective, this has been a journey that started with Col Reynolds 30 years ago. So now to be able to be moving into this space, to have mission funding, specifically, the exciting thing is this will be designated funding for paediatric and AYA cancers. So it'll be competitive. Researchers will be funding it, but we will definitely get an investment into that space, whereas lots of other sort of mission funding historically has been competitive for everyone. So it'll help us in that unmet need space. Paediatric and AYA cancers, so adolescents and young adults, has been, it's a population that the federal government have earmarked, and Cancer Australia for greater support as part of the Australian Cancer Plan, which is exciting then to see designated funding going towards everything that we try and do here to fund bold, innovative science, discovery projects that are going to be translated to the clinic, support programs that'll help kids, survivorship programs that they'll see them go, but also for them while they're having their treatment in hospitals and institutions, and with service care providers getting the best quality treatment, and then ongoing support post their treatment, which sometimes can be forgotten. Once you ring the bell, that's the end of your journey, but it's not really. As many survivors of cancer can tell you, it's a lifelong journey. So we hope to be able to support more and more people as they go through that journey.